Hello guys, welcome to my channel Dental for Everyone. Today's video is about cysts of the oral cavity. Parts of the cyst include a connective tissue capsule or wall, epithelial lining, and a lumen space. The cyst structure is similar to that of a coconut, where we can see a hard outer covering and an inner cystic lumen or an empty space. And an epithelial lining can be seen right below the connective tissue wall, lining the lumen space, similar to that of the white endocarp of a coconut. The topics covered in this video are definition, classification, and pathogenesis of cyst. The definition of cyst, according to Kramer, given in 1974, is a cyst is a pathological cavity having fluid, semi-fluid, or gaseous contents and which is not created by the accumulation of the pus. This may or may not be lined by epithelium. Cysts were broadly classified into cysts of the jaw, maxillary sinus cysts, and soft tissue cysts by WHO in the year 1992. Cysts of the jaw were further classified on the base of origin into epithelial and non-epithelial. A few common ones under non-epithelial are solitary bone cysts and ABC, aneurysm bone cyst. Epithelial cysts were further classified into developmental and inflammatory. Under inflammatory, we have radicular cyst, residual cyst, paradental cyst, and inflammatory collateral cyst. Developmental cyst is further classified into odontogenic and non-odontogenic. Odontogenic cysts are the cysts in which the epithelial lining is derived from the epithelial residues of the tooth germ. And in non-odontogenic cysts, the epithelial lining is derived from sources other than the tooth germ. There are many odontogenic cysts like odontogenic keratocyst, dentigerous cyst, gingival cysts of infants, gingival cysts of adults, eruption cysts, lateral periodontal cyst, glandular odontogenic cyst, botryoid odontogenic cyst, and calcifying epithelial odontogenic cyst. Under non-epithelial cysts, we have nasopalatine cyst, nasolabial or nasoalveolar cyst, mid-palatine raphe cyst, median mandibular cyst, and globulomaxillary cyst. Under maxillary sinus cyst, we have benign mucosal cyst and surgical ciliated cyst of the maxilla. Soft tissue cysts include dermoid and epidermoid cyst, lymphoepithelial cyst, thyroglossal duct cyst, anterior median lingual cyst, oral cysts with gastric epithelium, cystic hygroma, nasopharyngeal cyst, thymic cyst, mucocele, and parasitic cyst. Detailed explanations of these cysts will be given in the future videos. Histogenetic classification of cyst, which is based on the cell derivative of the cyst. These are classified into cysts derived from cell rests of serrae or dental lamina, which include OKC, lateral periodontal cyst, gingival cysts of adults, and glandular odontogenic cyst. Second, cysts derived from cell rests of Malaceae, which includes radicular cyst and residual cyst. Third, cysts derived from reduced enamel epithelium, which includes dentigerous cyst and eruption cyst. Moving on to the next topic, that is pathogenesis of cyst, which basically means the origin and development of cyst. The pathogenesis is divided into 3 steps, which is initiation, proliferation, and enlargement. Initiation or source of origin. There can be many sources of cysts in the jaw, namely tooth primordium, cell rests of serrae, cell rests of Malaceae, basal layer of surface epithelium, epithelial cells entrapped at the line of fusion, nasolabial duct, and nasopalatine duct. Proliferation, meaning the growth of the cyst. They can be influenced by many factors. The basic factors which help the proliferation are decreased oxygen tension, increased carbon dioxide tension, and necrotic debris. As the proliferation occurs, the central cells which are devoid of nutrition undergo degeneration, which ends up forming the cavity. Cystic enlargement can occur in three major growth methods, which are mural growth, osmolarity, and bone resorption. Mural growth meaning there's an increase in the mitotic activity in the epithelial lining, which leads to cellular proliferation or cellular growth, which results in increase of the size. Then there's osmolarity, which means the epithelial cells proliferate and their secretions are moved into the central cystic cavity to maintain the balance. This is why in the definition it is mentioned that the cyst can be filled with either gaseous, semi-fluid or fluid substances. And finally, we reach growth due to bone resorption. Resorption of the surrounding bone occurs due to prostaglandin E1 and E3 and osteoclast activating or stimulating factor. These factors are responsible for resorbing the bone and reducing the bone density, which aids in the expansion of the cyst. Hey guys, thanks for watching. Don't forget to like, comment and share this video and subscribe to my channel for more such videos. Do share your opinions in the comment section down below. Thanks for watching.